Welcome to another episode of How to Take Care of Your Body. I'm Dr. Paula Sauer, and today's episode, we're going to continue with the foot. If you're having foot pain, specifically plantar fascia pain, and what to do next. In my last tutorial, I taught you how to release the plantar fascia of your foot using this gua sha tool. This tutorial, I'm going to teach you what to do next. So now that you've released the plantar fascia, what now? Well, you get to go up the chain is what you get to do. So we're going to do more fascial release, but we're going to go higher up. Why? Because the plantar fascia is not exclusively disconnected from the rest of your body. The fascia is continuous. It goes up the back side of your heel and up the back side of your leg. So we're going to release all the way up to the back part of your knee here. So that's going to include structures like your Achilles tendon, the soleus, and the gastrocnemius. Okay, we went through this part on the bottom, the plantar fascia. Now we're going to go back here and up here. So you're going to take lotion or oil, whatever you like or whatever you have, and rub that into your skin. You're not going to want too watery of a base lotion because it may dry out or get a little funky. So something a little more oil-based is friendly or friendlier, and it has more glide to it. You're looking for glide. So you can start at the bottom here. The fascia is going to go on both sides of the calcaneus and around and under. So you can start here if you'd like, but it's easier. You have a lot of fat and you have a fat pad here, so it's going to make it hard to reach. So I like to go off the side here a little bit and then back behind here. Now, if you suddenly feel like a very specific sharp pain here or here, that may indicate that you could, I'm not saying that you do, but it might indicate that you could have a bone spur. The only way you're going to know if you have a bone spur is to see a doctor and have it looked at specifically, okay? There is no way to go, oh, I feel a bone spur here. You have to have it looked at by a doctor, okay? So I want to be very clear about that. So you're going to go up both sides of the calcaneus on both sides. I can show you only here because as much as I do yoga and Pilates, I can't twist my leg into a direction it doesn't want to go. So you're going to go up with large sweeping motions in one direction into the body of the muscle here. So we're going up into the soleus. You're not going to see on the back side, but I'm hitting the other side of it as well. You don't really want to massage the bone, the fibula here. That's not going to feel good. So when you go up that with your gua sha tool and you feel something like a very sharp pain, avoid that. That's the bone. It's not going to feel good, and we want this to feel good. We don't want it to hurt. So now we're making our way up into the gastrocnemius. It's just higher up. There's two heads to the gastroc, one on the medial side, one on the lateral side. I'll turn my body around so you can see. That's the lateral side. Here's where the fibula, oops, you can't really see. I'm going to flip my leg around so you can see. I'm going to go up the lateral side of the soleus and the gastrocnemius, the lateral head. Here, your ankle bone here is the distal part of the fibula. It goes all the way up to here. So if you're going up here and you feel like, oh, wow, that really hurts a lot more than what it did into the muscle, that's because that's where the bone is, okay? If you want to massage that, you can with the gua sha. It maybe doesn't feel as good as when you're into the muscle belly. And again, you want to go both directions. Up, you want to go down. We're using a larger sweeping motion. And then I'm going to get the medial side as well. Right down the middle of the back side here is a nerve So when you go down the middle of the gastroc head, right in the middle, that's gonna burn a little bit, and that's the nerve. So try to stay off of that because you're just gonna irritate the nerve. You don't need to massage a nerve. It doesn't need your help. It just wants to be left alone. But the muscle and the fascia, all of that is okay. So just like the bottom of the foot, you can also do shorter sweeping motions in all sorts of different directions. In fact, the more directions you go, the better. So the fascia isn't linear, it doesn't just go in one direction. It's organized in a way that goes multi-directional. And the more you can play around with the direction of your sweeping motion, the more value you're gonna get. Also, try to keep the muscle really relaxed. The more relaxed you can keep it, the deeper you're gonna go into this. If you tense the muscle up, you can try this. You're only gonna stay in the superficial layers more. So you really wanna try to relax this, okay? You can, of course, do this on both sides of your legs, not just one side. And we're pretty much done. You can go side to side. You can twist in there if you want. If you find a point that really needs a good digging in, use a lot of pressure, dig in deep, and then go in multi directions. Okay? All right. Here is your tibia. If you take your gua sha tool along your tibia very lightly, that can also be okay, but if you go very deep here, that's not going to feel very good. Disclaimer here, if you're on a blood thinner or you tend to bruise easily, don't go very deep with this tool or you're going to look like you're bruised up. In fact, a disclaimer in general with using gua sha or any kind of assisted device, your goal is not to create bruising. Your goal is not to turn your skin purple. Your skin, as soon as it turns a little pink, I don't know if you can see this here, mine is just a little pink here, that's it. That's enough. And you will heal better, heal faster, and in a more organized manner if you don't overdo it, okay? So this is all done and ready to go, and you're ready to go to the next part of this tutorial. Thank you so much for watching this tutorial. I hope you found this helpful. Of course, you can always do this release on your lower leg and your foot if you also have Achilles tendonitis or any pain in the back part of your lower leg. If you have any questions or comments, please put those comments down in the comment section. If you have questions or you have a request for a specific pain or ache you want me to address and how to take care of that on your own, let me know in the comment section as well, and I'll be happy to put that on my to-do list in terms of tutorials to film for this series. Thank you so much, and I'll see you next time.